Anita Hobson-Powell. I'm the Commonwealth Department of Health and Aged Care Chief Allied Health Officer. I've been with the department since June this year, or July this year actually, and I've come from 17 years working as the CEO of Exercise and Sport Science Australia. I was also on the board of Allied Health Professions Australia, and I was the chair of the National Alliance of Self-Regulating Health Professions.
What brought you to want to be in this role?
Look, I love the ability to be able to have an impact at a big level. Like, as a practitioner, you do get to work with clients and make a difference, but I've loved being able to work up and when I was at ESSA, be able to impact the full Australian community to access exercise physiology services. So now it's on even a bigger landscape of how can I make sure that everyday Australians have access to appropriate allied health services. So I love that ability to have a bigger role.
You said you weren't a trained, seasoned bureaucrat.
No.
Has it been surprising? Is it difficult?
Well, it's certainly learning the government processes, all the steps that you need to go through was a little overwhelming. And it was surprising around actually how much work is going on behind the scenes, that you think you're across all of this stuff out in the sector and engaging government, but you certainly get a new lens and respect for all the work that's going on. And, really seeing that it is a collaborative activity. So it's not just the section of allied health that's doing this work, it's workforce, disability, wider primary care, all coming together to consider allied health, which has been lovely.
And you said it's a very dynamic environment at the moment with a lot of policy reviews, change coming along. How do you, and you said that allied health is traditionally sidelined in these, it's the quieter voice in the room. How do you go about making sure that allied health is part of those discussions in the most productive ways? And I'm sort of wondering how much access to ministers. Do you hang out with the Chief Medical Officer and the Chief Nursing Officer at budget discussions? What's the level?
So it's been a bit varied, and I guess because it's still early days, but I'm getting around the department and introducing myself and letting them know that I'm there to support them. So, most sections have been wonderful and said, yes, when we're doing something, we'll reach out, and they have done that. I have intersected particularly with the chief nurse because they're doing their workforce strategy as well. So we're trying to get some alignment as well, because a lot of these strategies are not just about allied health. So intersecting with her. I've met a number of the medical advisors in the department as well, so that's been wonderful, and we've talked across some of the access to services. I have touch points with all of the ministers' offices. As you can imagine, Mr. Butler is quite busy, so just with one of his advisors, but particularly with Emma McBride is, we're setting up, I think we've had one meeting, but we're starting monthly meetings next week. So she's really interested to understand how the impact of allied health on the rural and remote communities, and then also with her mental health lens.
And coming to that then, do you actually view you've got allied health as an overview, and then is rural and remote allied health a completely different game plan?
Look, there'll be a lot of strategies which are very similar that we need to address, but in the workforce strategy we certainly have pulled out in the draft of rural and remote, because there is going to be particular strategies that we need to put in place to address getting the increased numbers out there, but also supporting them while they're out there so that they actually do want to stay. So yes, they're going to have additional strategies that we put in place, particularly for rural and remote.
And what's your takeaway on that? What are the big challenges? We've heard a lot about them, and you've been here all day, yeah? We've heard a lot about the workforce issues. Where are the solutions? Do you see them emerging?
Look, I think there's a couple of one, I think we're going to have strategies to get workforce out there and push some workforce. So how do we incentivize people to move out? The big one that's definitely coming through is how do we get training happening in rural and remote communities? So how do we work with the university sector to support people staying at home? Just talking to someone who was saying that they've got an allied health assistant really interested in podiatry in the NT. There's no podiatry courses in NT, so she actually has to move out of state. So it's, how do we support people locally? And then also, how do we support their professional development in a local community too, so they're not having to come back into metropolitan areas to do things? Or how do we give them career progressions out in their local communities, rather than, yes, I've got to go to a capital city to actually feel like I'm making a difference, or progress the chain that we often think about. So yes, I think there'll be a lot of things that we need to tackle as to support the rural and remote communities.
And you really can see that solutions are emerging there?
Yeah, look, there's been some great ideas that have been come up today, and it's been really nice to see, particularly today, around really local initiatives that's going to work, rather than us in metropolitan areas come up and say, oh, this is going to work, and not really understanding the sector. The other thing with the workforce strategy is, I think that it's not just about government delivering this strategy. It is going to be all of sector, and employers, local health services are also going to play a role, and how do we all get to talk to understand who's doing what? How do we also, like conferences like this, share the learnings, because what's happening in one regional area probably can happen in another area, and they don't have to rethink about it and duplicate the same sort of processes.
I'm interested in what has popped out for you today. What sort of programs, what presentations, what topics?
So I think it's definitely been around supporting people in local areas, particularly around some of the cadetships that are happening to keep people in local areas. That's been lovely to see. Also around some of the training that's been around interdisciplinary practice. So how do they all learn together, because that's what we want. So we want them learning at the start. But I guess what has been, it's not surprising, but it's been lovely to see, is the passion that is coming through. Like, these people love working in a rural remote area and are dedicated to their communities, and it'd be nice to package that up as well. But yeah, I think you can't stop the passion that's here, and they are really genuine of serving their communities. So they just want opportunities to help them be able to do that.
And what about the Allied Health Rural Generalist Pathway? What's its status in discussions around the strategy, the workforce strategy?
Yeah, so it has no longer been funded by the Commonwealth, so the decision was not to continue with that funding program. However, as part of the workforce strategy, rural generalism is certainly still part of the discussions, and the program is still running. It's being supported by state and territory governments. It just has not got federal funding at the moment. But it is one of the pathway options that we need to support rural and remote communities. There are lots of other options that we also need to factor in, and one solution is not going to achieve everything we need in the rural and remote communities.
But are you lobbying for funding to be restored for that from Commonwealth?
I guess that's not my role to advocate for it, but what I know from talking to the workforce area, that they will be looking for guidance from the workforce strategy of where we need to put funding. So there will be certainly some discussions with them, basically on what the sector is asking for, and hopefully we can get funding for rural and remote services.
Okay, and allied health assistance has been another big recurring mention here, that's really picking up the slack for people and just assisting along the way. Do you see a big role there, an expanded role?
Yeah, look, the allied health assistance is certainly growing. It certainly wasn't around a few years ago to the extent it is today. But yes, definitely through the aged care and disability sector, they're showing a huge role for those, and I guess that's why we're developing some guidelines to support the delegation, particularly in primary care. At this point, they're not really funded, so there's no MBS items in the private care to support them, but under the aged care and disability package, you can support an allied health assistant. So they play three sort of main roles of: one, they do provide a pipeline for people wanting to become allied health professionals. Two, they support the work so that we can ensure that we've got the limited resources with allied health professionals, so we've got support mechanisms there. But it is also through this delegation frameworks that, you know, the consumers get confidence that the allied health assistants are working in line with the allied health professionals to develop appropriate care.
As you said, that it's such a complex issue. It's an intractable problem. There have been gaps for so long. Do you actually feel confident that reform will happen in the way it's needed, or is it a long way away?
I'd like to think I'm an optimist that things are happening. Look, some things are definitely going to take a little while. It's being a federated country, you know, getting everything aligned does take time and agreement, but I think there's a lot of positive signs around change. But, you know, I was talking in my presentation today, like I think a lot of the change can really come through grassroots too. Like I think if doctors and nurses get to experience firsthand what it is to be in a multidisciplinary team, or they get to see the outcomes that an allied health professional have, more likely they're going to have more changes. Or through the PHN's commissioning, we see multidisciplinary teams. If it's working for one group of cohorts of patients, it's going to work for another. So I think a lot of the big reforms, it's going to need that grassroots application for change to happen. So hopefully top and bottom approach will get the reforms.
So who does that rely on to make that happen, that grassroots? Where does that happen?
Well, hopefully it's through some of the presentations I do, or going back and talking to associations who can get to their grassroots of getting them to understand the importance of some of these changes. So if they're part of one of the PHN commissioning projects, for example, so just say they're doing a diabetes project, is, you know, that will see not only improvements for diabetes and the patients, but the GP gets to work in a multidisciplinary team, and they get to then have that interactions, and then hopefully when they go to their conferences they get to tell their colleagues, or, you know, I was getting these outcomes from multidisciplinary teams. So I'm hoping that, you know, it just starts this little bit of talking, which leads to more talking, and people are showcasing the outcomes that they're getting as well.
One just out of the blue on this, it hasn't come up a lot here, but climate change, how much does that factor into your thinking in terms of delivery of allied health, particularly in rural and remote areas?
Yeah, so the Commonwealth actually are just forming a working group around climate health through the CDC section. So it's only just come onto my radar last week, but, you know, I from talking to allied health professionals, they have a lot of interest in this space, and particularly around the cost of their services having an impact on the environment, and particularly with the younger generation coming through. So it's something we need to be acutely aware of. I just think for the professional associations, there's so much health reform coming on, and little resources of their picking and choosing. But, you know, this is an important area. And so hopefully this working group will come out with some, you know, good guidelines that will help allied health professionals deliver services that consider the environment.
And will it be part of the workforce strategy, the impact of climate change on the workforce?
It hasn't come up. It hasn't come up, but I think it will certainly be a consideration, and you know, a lot of this comes up as the travel that allied have to do, allied health professionals, and particularly not just delivering their services, but to attend events and so forth. So, we certainly are mindful of the impact that travel has on climate health as well.
But it's also having an effect on retention.
Absolutely, absolutely.
Yeah. And just wondering, are you going on a road trip yourself? Having said that, it's not a good idea to do too many of them, but
Yeah. Look, I'm slowly getting around the country. This last 2 weeks have been busy, but yes, starting to go out to some of the stakeholders, particularly I'd say the peak of peaks. So Sarah. Allied Health Professions Australia last week, the Deans of Health Sciences again this week, of getting to groups where I can get the conversations happening, mindful that it's taxpayer dollars, so trying to make sure that it is strategic in where I'm travelling and how I can build on some other work that happens as part of that. But yes, getting out and meeting people. I'm keeping a tally of all the meetings that I'm having, because that's one of the key roles, is to really show that the department care about allied health and show that we're listening. So I'm trying to engage with as many stakeholders as possible.
But will that mean actually